Vaccinations. My name is Mark Graham. I'm the Vice President of Program Services at Coordinated Behavioural Care. And on behalf of CBC, I welcome you here to our second town hall. Some of you hopefully attended our first town hall back in January. Our town hall sessions came about really because of our member organizations. CBC were approached by several agencies in late December who found that a number of their staff had questions in relation to COVID, from practical questions around transportation to more complex questions about taking vaccinations and supporting family members through COVID. In response, we looked around to find really an expert in the field, someone who could help guide us and keep us abreast of the most up-to-date information on COVID in the United States and beyond. And we were fortunate to find Dr. Trivedi, who will shortly introduce herself. And she joined me on the first session back in January. And our town hall sessions are really an informal conversation. We sought out questions from our workforce, issues that are on their mind, that we were able to phrase into questions for them. And we'll go through some of those today. Our first town hall was very general. It covered a lot of different topics in a short period of time. And we learned from that so that we've increased the time of this town hall to 90 minutes, but we've also decided to focus on a particular area. And that area today is around vaccinations for COVID-19. And we're going to be looking at that through several different lenses. One about the vaccine itself, then around side effects, and then possibly about sort of return to work and return to norm once the vaccination is widely available. As Tasmina said, the Q&A button is there. Please chat along with us and we will incorporate your questions as we go along. Any that we don't get to we will respond to via email after this town hall today. And so with that, I'll hand you over to Dr. Trivedi. Thank you again for joining us today.
Thanks, Mark. It's been a pleasure for me and my team to work with CBC, and we're excited to provide this education and get some information from you all on what you would like more information about as we move forward as well. So I'm going to start my slideshow. So just for a little bit of background on myself, I'm an epidemiologist. I have worked at the Centers for Disease Control and Prevention in Atlanta, and I've also worked at the California Department of Public Health. For the past 7 years, I have been in consulting, and I've consulted on various aspects of infection prevention and control. I'm also a practicing physician at the Veterans Administration Hospital in San Francisco. So you all are probably very well aware of what is happening with the pandemic currently. We are now kind of coming out of this third surge. And this is information from yesterday from the CDC, updated through yesterday, showing us that our rates are certainly coming down. However, we are still higher than we were in either of the first or second surges in terms of where we are in the entire United States. So really happy to see numbers come down, but we're still in very, very high numbers of cases as well as deaths. In New York State in particular, as of this morning, according to the New York Times, the number of total cases reported of COVID-19 in New York are at 1.4 million cases, which has dropped significantly in the last 2 weeks. Deaths are still higher than we would like for them to be, but we are seeing a slow drop in deaths over the last 2 weeks, and our hospitalizations are slowly coming down. So we do expect deaths and hospitalizations to come down much more quickly as these cases continue to come down. And on the right-hand side of your screen, you'll see average daily cases per 100,000 people across the state of New York. And you'll see that there are some counties where rates are still higher than others. So what we spoke about last time, and I just want to reiterate today, is this concept of Swiss cheese and how we want to place various slices of Swiss cheese between us and the virus such that we don't have transmission occurring. And the reason we talk about Swiss cheese is because Swiss cheese has holes in it, and all of these interventions, when we implement them, can have some problems with implementing them, which is why we don't want to just rely on one slice of Swiss cheese. You want to rely on multiple slices, because as you layer Swiss cheese between us and the virus, you likely will not have any of the holes that align, allowing the virus to be transmitted to us. So these slices of Swiss cheese we're talking about are staying at home if you're sick or exposed. That one I know is really difficult, especially for many of us that enjoy working and enjoy getting out of the house. But that is a really important slice of Swiss cheese for all of us to protect our families as well as our communities. The second slice is wearing an appropriate face covering, which I'm going to talk about in the next slide for a moment. The next one is physical distancing, trying to maintain that 6 feet of distance if you can from people outside of your household. If you can't, wearing a face shield can be helpful. And then lastly, keeping your hands clean. And the reason we still talk about keeping hands clean is not because we care about surfaces, because you all know that we are moving away from talking about surface transmission, but we know that people touch their faces and touch their masks and touch one another. So when you do that, you could potentially get the virus and particles and droplets on your hands, and then inadvertently infect your own eyes, your nose, your mouth, or even that of a loved one. So I really want you to think about these slices of Swiss cheese, layering these between us and the virus. So a moment just about face coverings. There's been a lot about this in the news recently, and there was actually just a great publication this morning from the CDC around face covering. So the two things we want to talk about here are filtration and fit. So you want to assess the material that your mask is using, if it has a good filtration efficiency, and then the fit. Does it fit around your face well? So the best face covering is the one that you put on that you do not touch when you're outside of your household. You get on the subway, you go see clients, you do not touch your face covering. That's ideally what we want you to do. That face covering will have a high filtration efficiency. So you've chosen maybe a surgical mask that has a high filtration efficiency. So that mask is allowing you to not be interacting with the droplets. And then lastly, that it fits your face. Right? All of our faces are very different. Different masks fit our faces differently. Some of us that don't have high nose bridges don't need as much of the of a steel, a metal around your nose bridge that you have to fit. But the fit is actually quite important, because some of the surgical masks that gape around the sides aren't as efficient at preventing spread and transmission, because it allows droplets to come into the sides. So in terms of a hierarchy and the way I think of face coverings, the best one is probably a medical grade N95 that's fit tested to your face. Now, if any of you have worn those, you know it is extremely difficult to breathe for a long period of time in an N95, right? So this may not be the right mask for you in your situation. If you are a healthcare provider that's in a hospital working with COVID-19 patients, that is the right type of mask for you. However, if you're not in that environment, it may not be the right mask for you. An equivalent is also a KF94. Those are ones that are made in South Korea that have a little more consistency in terms of the filtration efficiency. Then we get into surgical masks, and surgical masks ideally are form-fitting surgical masks, the ones that you can put on your face and that actually fit well around your face and around your nose. For those of us that can afford buying a brace or some sort of a device that can help the surgical mask fit better, that's a possibility. And others of us can actually just put a cloth mask that fits over your face nicely over the surgical mask. And that will allow you to get to that good high filtration efficiency and will also allow you to have a good fit. Then we get into the 3-ply cloth mask, the 2-ply cloth masks, the neck gaiters, and then finally, of course, is wearing nothing. So for those people who have not been wearing a mask, we would recommend any mask. But then if you are engaged in wearing a mask, I think there is this kind of hierarchy of masks to think through. And you might consider deciding to wear a mask in specific situations. For example, if you are going to the grocery store, you might consider wearing a surgical mask with a cloth mask over it, because that allows a better fit. If you're going for a walk in your neighborhood, you might decide to wear a 3-ply cloth mask or a 2-ply cloth mask because you're able to maintain distance from other people and you're in an outdoor environment. So we do want you to look at different face coverings and look at the situation you're in and decide which one is the best for you in that particular scenario. All right, now I'm going to hand it over to Mark to help me talk more about vaccines.
Yeah, and we'll come back to masks a little bit, because I think post-vaccine, where to wear a mask or not. But some of what you said there was very interesting, because I think there was a stage of wearing fancy cloth masks that I went through, and probably not at some of that looseness that you talked about. But to vaccines itself, and so I think, really the crutch of why we're here today. Last weekend was to me, a very sort of sobering anniversary. It marked the first anniversary of the first known death to COVID in the United States. And since then, there have been 400 and I believe 70,000 or over 70,000 deaths in a 12-month period, which I think any of us would find sobering and shocking. And your graphs there showed these surges that continue, and the third surge being worse than the first two. And so for some of us, I think vaccine has become that talk about silver bullet, if you will, and more talked about since the beginning of the year, but comes with anxiety, which is, I think, in a lot of questions that we'll probably go through today. But so I have it right, so for the audience, in the US, there are currently 2 vaccines approved by the FDA, Moderna and Pfizer. And some of what I've read is that both were kind of really fast-tracked through that process. How safe is something like that if it's fast-tracked? We know we need it. Did things get rushed through?
Yeah, great question. So here we have the traditional timeline for how vaccines are approved. So usually we go through an exploratory phase, then we go through a preclinical phase, which is when we use animal models to test out the vaccine. Then we do clinical trials, and we go through phase 1, phase 2, phase 3 clinical trials with humans. The phase 3 clinical trial is specifically done to assess safety and efficacy. That's the reason we do the phase 3 clinical trial. Then it is presented to the FDA for review and approval. And then after that, once the FDA has given its full approval, then we manufacture the vaccine. So this whole process usually takes around 10 to 15 years. However, when you're in an emergency, in a pandemic, you can accelerate the timeline. And so on the bottom half of your screen, you can see the accelerated timeline, which we have been engaged in during the pandemic. So exploratory preclinical phases occurred, and then quickly we went into clinical trials. The FDA did a rolling review. So after each one of these phases was completed with each of the vaccines, it was presented to the FDA. And then once we started the phase 3 clinical trials, actually our government doubled down and engaged in at-risk manufacturing. So they actually went ahead and asked the companies to start producing the vaccines just in case they were efficacious and safe. So I wanted to highlight for you all, Mark, that none of these steps were truncated. None of the steps were skipped. It's just that we overlapped many of the steps. And the other thing to note is that scientists around the world were focused on this development of these vaccines. And so all effort that was going into other things did not happen during this period of time, which is why we were able to get through this vaccine timeline in less than a year.
But you still have, so we have Moderna and Pfizer.
Mhm.
There's differences between the two, or is it simply like, I just know that one, it takes 3 weeks in between shots and one's 4 weeks? Like, from a common person like myself, what does that mean?
Oh, I lost you there for a second.
I was just what the difference is between the two vaccinations, especially between the time from first shot to second shot. Why is there a difference?
Yeah, so let me just highlight one thing here real quick. Sorry, I'm just going to go through my slides and get the right one here. So yeah, so the Moderna and the Pfizer vaccines are both mRNA vaccines, which are new to us in the sense that we don't have any other mRNA vaccines that we have used. The mRNA vaccines cause cells to produce the spike protein and elicit a protective immune response. The technology, though, behind the mRNA vaccines has actually been being studied for many years. It was discovered in the 1990s, and we've been studying it for the last few decades. The things to know about the mRNA vaccines in particular are they do not contain live virus, and they do not alter a person's DNA. But because they are made out of RNA, it's actually an unstable thing compared to DNA, unstable genetic component compared to DNA. And so because they're so unstable, they actually denature at high temperatures. And that's why we have to keep them extremely cold when shipped and stored. So the things to know about the mRNA vaccines is they are new, but this science has been building over the last 30 years. They do not contain any live virus, and they do not alter a person's DNA. And then the way that a lot of people on this call might understand mRNA vaccines really well is that they don't actually, they send a message to your immune system that shows the immune system what the virus looks like, gives it instructions on how to kill it, and then, like a Snapchat message, which is not something I use, but I assume many people on the call use, it disappears. So that initial message that's sent to your body that comes in the form of the vaccine, that initial message actually disappears. So I know there's a lot of fear around this new technology, but I just want to assure folks that the mRNA vaccine technology is amazing technology that will change the direction of modern medicine, because this is really such a novel way to introduce a pathogen to the immune system and allow it to react. Now, the reason that there are these slight differences between the two vaccines, the Pfizer vaccine and the Moderna vaccine, is because of the way that they were studied. So the Pfizer vaccine, the way the clinical trial was set up was that after 21 days, all the vaccinated folks got their second dose. And for the Moderna trial, it was after 28 days. Mm-hmm. So we want to follow the science, and that's why there's a slightly different regimen in terms of when you are supposed to take the second dose of vaccine. But okay. It operates in exactly the same fashion.
Just on that,
yeah.
Why do we need a second dose? Like, why, we're in the age of convenience. Why not just one and done?
Right. So the way that these trials were studied were that if after you got the first dose for the Pfizer vaccine, for example, the efficacy was only up to about 50%. And for the Moderna study, after the first dose, they only got to 80% efficacy. So the reason you want the second dose is because that's what gets you up to that 95% efficacy for mild infection, 94, 95%. So we do feel like the second dose is actually quite important to get to that really high efficacy.
So I'd heard a sort of there's so many rumors out there about COVID vaccines and stuff, is that some cities or states may be running out of the second vaccine. So they schedule everyone in, get everyone vaccinated with the first, and there isn't enough vaccines in 28 days for a second dose. One, is that true? And two, if that's the case, is it okay? Like you missed your second one because you're 60% covered?
So it's an interesting question, and there certainly are a lot of public health professionals and experts that are trying to get the US to just give out the first dose, because the more people that get the first dose alone, the quicker we likely will be out of the pandemic, because at least there will be 50 to 80% efficacy with a large number of people. So far, the US government is not advocating for that. Again, because we want to follow the phase 3 clinical trials the way that they were undertaken. So we are asking people to try to get that second dose. But I will say there's a little flexibility and when you get the second dose. So if you're not able to make that second appointment exactly in that 21 or 28 day interval, you are still we still recommend getting the second booster at some point in the future. I will say that there's some new data that's come out that shows that people that have had the virus itself may only need one dose to help boost their immune systems up. But again, none of this is official recommendations yet. We're still recommending both doses for anybody, even somebody who has already had the infection.
And it's just, I suppose, to continue in that sort of area, later this month, the FDA are likely to approve the Johnson & Johnson vaccine, mm-hmm. which is one and done. And I know it has a lower efficiency rate and stuff. Is that again just following the science in saying that's what Johnson did in their trials, or should those folks be looking to get a second dose somewhere?
No, I think that it's a really good point. So the Johnson & Johnson vaccine does have a slightly different mechanism of action. So it's a double-stranded DNA vaccine that's vector-based. So it enters your body via an adenovirus, which is a common virus that many of us have had that gives us the common cold. But this virus actually is a non-replicating virus. So it's just a way to get the double-stranded DNA into the body. And it does appear to have slightly lower efficacy with mild to moderate infections than the Moderna and the Pfizer vaccine. And the great thing about this vaccine is it doesn't need those extreme cold temperatures to store and to ship. And the other thing to note is that the Johnson & Johnson trial, was done much later in the pandemic, when some of these variants have been, and I know we're going to talk about that later, but some of the variants have been more in circulation. So the slightly lowered efficacy may be because they were able to do the study later in the pandemic, and it may actually be a little more relevant to what our bodies are seeing right now. So, but no, we would recommend just the one dose of the Johnson & Johnson vaccine. And actually, can I add one, let me just go through this slide real quick, Mark. So even though there are these slight difference in numbers between the vaccines, so 95% efficacy for the Moderna and Pfizer vaccine, 72% for the Johnson & Johnson vaccine, the thing I want you all to focus on is that all of these vaccines are 100% effective at preventing hospitalization and preventing death. So the slight variation that you see in efficacy is around mild to moderate infection. It's not around severe infection and around hospitalization and death. All of these vaccines do a great job with preventing hospitalization and preventing death. And so that really is the primary endpoint. And then the secondary point is how it does in terms of preventing mild to moderate infection. So that's where you get the difference in efficacy.
And so with the consumer choice, will it get to a stage, or like come March and Johnson & Johnson said, can I go and say, oh, I want to get that vaccine, I want the Moderna, my preference would be this? Is that going to be an option, or is it just whatever's there?
Yeah, I think because right now demand certainly outweighs supply. I think when people go to get, they make a vaccine appointment and go in and get whatever vaccine is available. I think many places are not even sure which vaccine they might be giving out that day. It just depends on what the supply is. So I would encourage, like I said, all of the vaccines that are going to be leading are going to be available in the US all have 100% efficacy against death and hospitalization. So I would encourage you to get whatever vaccine is available to you at that time. We don't have a lot of data on if one vaccine is better in certain groups. There are some studies being done, like the Novavax vaccine is being studied specifically in HIV positive people more than some of the other ones. So we might have some more information around specific populations. But right now, we don't have that data. And right now, we are recommending any of the vaccines taken in the way the phase 3 trial was done for anyone who wants the vaccine.
So just, there's a couple of questions that are coming in the chat. I don't know whether you can see them, just in relation to the people have heard that the vaccine does not actually prevent infection or transmission. It will just prevent a severe dose or potentially death. Is that accurate? And I think the one below it, so won't stop someone from getting the virus. Is that the?
So it's a really good point. And let me just address that. So we do have positive signals in all of our studies from the Pfizer study, the AstraZeneca Oxford study, as well as the Moderna study, that the vaccine does decrease transmission in vaccinated participants. Mm-hmm. Now, the reason why we can't definitively say any of this is because, again, the point of the studies was to prevent death and hospitalization, which they did. So then we start parsing out some additional information. For example, on the left-hand side of your screen is data from the Moderna study. And what they did was they swabbed all participants before their second dose. So remember, they're not even at the 95% efficacy at this point. They're like around 80%. And when they did that, only a very small number of people in both the placebo arm and the vaccinated arm ended up with positive swabs. So they actually had virus in their noses. And the group in the vaccinated arm had much lower rates of the virus in their nose than the placebo arm. So because of those types of small pieces of information, we do believe that the vaccine prevents disease, certainly, but it also helps decrease infection. And we saw that also in the AstraZeneca Oxford trial, which is on the right-hand side of your screen, where they found that the vaccinated participants, their asymptomatic infection rates were actually essentially higher than what I have here, 67% decreased in the vaccinated arm. So we do have some really positive results around decreasing transmission. And let me just add that all of us kind of in infectious diseases, we've never seen a vaccine that prevents disease and doesn't also prevent infection. That is something that naturally these vaccines should do. So although we are being very transparent and we're not telling you that it does absolutely prevent infection, we believe that in the end, we will see the science that it does. And I think this is a really important point for many of our listeners who are in multi-generational homes, where you have children who are not yet able to be vaccinated. You being vaccinated potentially prevents you having the ability to give the infection to other people in your household who do not have the ability to get vaccinated. So being vaccinated not only protects yourself, it also can potentially protect your household and your community.
And a very sort of practical question. Will I have a copay for a vaccine? Like, is it, what's the cost and who's paying for it?
Great question. The government is paying for it. You will not have a copay. The government is paying for it. My understanding is people who do have insurance, who get it from their healthcare providers, the healthcare systems may ask insurance companies to cover the cost. But when you go to one of these mass vaccination sites that's provided by the public health department, that's implemented by the state or even FEMA, actually the federal government, you will not be paying for the vaccine at all. No.
That's great. And before we move on to sort of the next section, sort of effects of the vaccines, you had sort of referenced this before. If someone has had COVID-19, do they need to get the vaccine? Like, can they just skip it? Or if they've had it, how soon after they've had it should they get the vaccine?
Right. I think I might have a slide about this. Let me just bring it up. Yeah. So the second to last bullet here, the vaccine should be offered regardless of a history of prior SARS-CoV-2 infection. The only thing that is being recommended is that you can defer it until you've recovered from your acute illness. So that is if you have symptoms. But we are recommending that, anyone who doesn't have an acute infection get the vaccination. And you could delay. Let me actually say this also. Given that we know antibody responses are high for the first 3 months after infection, you could delay it for 3 months after you have the infection. But if you don't want to, you are welcome to go ahead and get the vaccine. And as I mentioned earlier, there are some new studies coming out that people that have had the infection and that get a vaccination may actually have a really robust immune response. So for those of you that have had the infection, I would absolutely try to go get the vaccine, because you may be able to really boost your immune response and be really well protected from infection.
Cool. So I wanted to move on to talk a little bit about potential side effects, because it's obviously an area of anxiety, and most medication come with a long list of side effects. So what are we seeing?
Yeah. So the safety profile, and I'm just talking about the Moderna and the Pfizer vaccines, because those are the only ones that are available in the US right now. We do see some short-term mild to moderate pain at the injection site. We have had a lot of patients that have complained about pain and pain in the arm, and having kind of decreased mobility in the arm for 24 to 48 hours. And then we are seeing more commonly fever, fatigue, headache, some more kind of systemic responses to the vaccine after the second dose. We are hearing about that more anecdotally. I've heard about it more with the Moderna vaccine compared to the Pfizer vaccine. Other people go through both doses and feel completely fine. So it really is variable. I will say that more people that are in the younger age group, 16 to 55 years of age, have had more symptoms than people in the older age group. So our elderly folks, we are not seeing as many side effects, which is good. But we also believe that the side effects are it's a way that your body is telling you that it's developing that immune response. So we in some ways we welcome the side effects, because we know that means your body is developing those antibodies that you want it to develop. In terms of serious adverse events, the only serious adverse events that we believe are directly related to the vaccine are anaphylaxis, which is a severe allergic reaction where your throat swells up and your airway sometimes is blocked. We have seen that in a very, very few number of cases with the Pfizer and the Moderna vaccine, 5 per 1 million doses with the Pfizer vaccine and 2.8 per million doses with the Moderna vaccine. The reason, well, because we're seeing this, everyone will be observed for at least 15 minutes after they're given the vaccine. And for those people with a history of allergy, you will be watched for 30 minutes and observed for 30 minutes, because we want to prevent this anaphylaxis from happening. And I'll just, end kind of the safety profile discussion by saying that not a single person has died from having the virus itself. And I know that there have been some media blitzes about people that have died around the time they got the vaccine. We don't believe any of those people died from the vaccine itself. So we believe that the mRNA vaccines are actually extremely safe, except for this slight allergic reaction risk that we are trying to combat with that observation period.
Right. And just to go back just a little bit to the side effect side of it, though, and because I've heard more, and probably through social media too, of that sort of people getting their second shot now, and there's more talk of a side effect in relation to that. But it's not everyone. Like you and I had talked, and we've both been fortunate. And I didn't have any side effects from a second, and you did. And I think you spoke to me a little bit about it being like, yeah, it wasn't pleasant, but it's not as bad as getting COVID itself or a bad case and stuff.
Right. Yeah, so yeah, Mark's right. I because I'm a healthcare provider, I was able to get the Moderna vaccine through the VA system, and I got my second shot a couple of weeks ago, and I became quite ill for me. 24 hours after the vaccine, I had a fever, I had headaches, I had extreme fatigue, I couldn't work. What I was telling Mark is that I felt so kind of honored that I hadn't gotten the virus yet, and that I only had to go through the immune response process to the vaccine, which in and of itself was really hard for my body to handle. And so I can imagine, and I know from my patients that have had the virus and at the same time are then building that immune response, that is really hard for our bodies to handle. So having the virus itself and dealing with the effects of the virus entering our cells, and creating havoc in all different systems, especially the respiratory system, that in and of itself is hard to manage. But then I think the immune response is also can be really harsh on your body. So I think those of us that get the vaccine should definitely take it easy the 24 to 48 hours after you get the vaccine, knowing that you may have some of these side effects. But I think it's another way to feel really grateful that we're just able to get the vaccine and not experience the virus itself.
Something I heard, just because of we're hearing more about those side effects, and even from the arm and a stiffness in the arm that people have. I've heard of people like taking a strong dose of ibuprofen before going in, but I heard advice that that's not the right thing to do. That
Right.
we normal, like, even though it's sort of a protective factor in a way, just in case. Is there anything you could comment on that?
Yeah, definitely. So we're not recommending prophylactically taking ibuprofen or Tylenol, because it can blunt the immune response. I mean, that's the whole point of a non-steroidal, right? The whole point of an ibuprofen is to decrease your inflammatory response to something. And so we actually don't want you to do that when you get the vaccine. We want the immune response to happen so that your body develops those antibodies. So we're not recommending you take prophylactically Tylenol or ibuprofen. But if you are then if you develop the side effects, that means your body is producing that immune response. In that situation, I think it's okay to take some Tylenol, ibuprofen to help get over some of those symptoms, but we don't want people to take it prophylactically, no.
So there's a question in the chat box, and I think it's sort of interesting because it's so I was fortunate. I got to have the Moderna vaccine as well, and I had my second dose. And the person here is asking, if you're older, which would be me, probably to you, and not getting an immune response, like, and I didn't. I was, fine in the days after. Am I still protected then to the same level?
Yeah. So in the studies, we found that older people had the neutralizing antibodies and younger people had the neutralizing antibodies. So just because your body experiences the side effects or doesn't experience the side effects, that doesn't directly correlate with the kind of amount of antibody response that your body is developing. So I would just say you're lucky that you didn't experience what I experienced. But and I think older people, the other thing to note too is that the robustness of, I think I heard somebody say this, that these vaccines are so good at having you develop an immune response. You're kind of in that super awesome level of antibodies that you're producing. So if you're even at the sort of awesome level, that's still awesome. Does that make sense?
Yes.
It's not lower than average. It's still in that amazingly high range. Again, why probably these 2 boosters are really necessary. So you can boost your immune system up to whatever is the maximum level to help protect you against this virus. So yeah, no, I wouldn't take the side effects to mean and to correlate with how robust your own personal response is.
Yeah, that's a good question. Earlier, you were talking about sort of following the science in relation to the timing and stuff. If I read correctly, somewhere along the way, in the early trials, pregnant women were not included, and yet they are encouraged to get the vaccine now. Is it safe for someone who's pregnant or breastfeeding?
Yes, that's a great question. I think I have one. I might have. I think I'm yes. So yes. So in the trials, the Moderna trial and the Pfizer trial, there were no pregnant women that were specifically included in the trials. So because of that, we cannot specifically say that we have safety data on pregnant women with these COVID-19 vaccines. However, there were a few women who became pregnant during the course of the trials, and they all have had, most of them have had very positive outcomes from getting the vaccine. There were a few people that had spontaneous abortions, but when the trials were evaluated by different independent experts, nobody felt that those abortions were related to the vaccine itself. The other thing I would note is that pregnant women are at very high risk of having a poor outcome if they do develop the infection with the virus. So that would be the other thing to think about. And I think that's why we've had so many women. I think the last number I saw is that 15,000 women have actually opted to get the vaccine while pregnant. So a large number of people in the country and in the UK have opted to get the vaccine, even if they were pregnant, because the data is so positive that it will help protect them and their unborn children. And then we have some new data actually just a couple of days ago that some pregnant women who got the vaccine and developed antibodies were able to pass those antibodies onto their infants when the infants were born. So you may actually be protecting yourself, but also then be protecting your infant as well.
That's great.
Yeah.
And then last, before we move on to the next section of ways, once you get the vaccine, like how long are you immune for? Is it the 3 months? I've heard that from some people that you'd really need to top up then, or is it a full year, or do we know?
Yeah. So we don't entirely know yet. We are studying the group of people that were vaccinated and looking at how much neutralizing antibody they continue to have. We do believe right now that vaccination does allow you to have at least 6 months of protection. But I think that number will increase as we study the group of vaccinated people longer. And I think the other thing to note is that with these variants that are starting to kind of make a play for more transmission in the US, there is a lot of movement on the side of Moderna and Pfizer to develop a booster vaccine that can more easily combat some of these variants. And because it's an mRNA vaccine, it's very easy to tweak the spike protein within the vaccine and develop a new vaccine pretty quickly. So that's what the discussion is happening right now. But as far as we know at the moment, you should be protected for at least 6 months.
Okay. And so to move on to a little bit sort of post-vaccine. So for those who haven't sort of gone to one of those sort of centers, after you get the shot, you're observed for 15 minutes. And if you've had allergies, which was one of the questions that we had last time around, it's for a longer period of time. But, you know, normally you take any medicine and antibiotics and it comes with all the do's and don'ts. And I kind of laughed not knowing what was safe to do and what wasn't safe to do. And some people have asked me that sort of question. One about even alcohol. Like, is it safe to drink after you've had a vaccine? If so, when? Like a week later, the same day? Is there any sort of studies in relation to that? No.
Yeah, no, there aren't any studies in relation to that. Because of the way the mRNA vaccine is being introduced into the body, I don't think it matters if you decide to eat something in particular or decide to drink something in particular, because the mRNA vaccine is being introduced into your cells and is not going to be inhibited by alcohol or a certain type of metabolite. So yeah, there are no restrictions that we know of yet around getting the vaccine and doing anything specifically. I will say though, that that 50% efficacy or the 80% efficacy that you attain after the first dose, that usually doesn't happen until about 1 week to 2 weeks after the first dose. And then you're not fully protected with that 95% efficacy until you reach 1 week after the Pfizer dose, the second dose, and 2 weeks after the Moderna second dose. So what's important to know is that unfortunately, we have had people who've gotten the infection after the first dose of vaccine and even after the second dose because they didn't wait that entire 2-week period after they got their second dose before they engaged in, maybe riskier behaviors. So I would say that just because you get the vaccine doesn't mean you're protected at that moment. You have to really wait until you get the second dose, and it's 1 week after the second dose of the Pfizer shot, and it's 2 weeks after the second dose of the Moderna shot where you achieve that 95% efficacy.
And just back, I mean, this is skipping back a little bit, but you had talked about sort of the side effects that you'd experienced. Is there somewhere to report that to? Like if you're feeling like, should we be reporting it? So for future studies or whatever it might be, if we experience side effects.
Yes. And this was initially with healthcare providers was definitely pushed in the early kind of first month of vaccine distribution. I haven't seen it as much since, but there is a website called VSafe, V-safe at the CDC, where they are taking information about adverse reactions from the vaccine. So
Mhm.
if you do experience any adverse effects, I would report what those adverse effects are to VSafe so that there can be accurate information as we move forward as to what percentage of people actually have these side effects.
Right. And to follow up to one of your other points about the sort of potentially the vaccine making you good for 6 months, I say like, as mental health professionals, people in the community, what do we do at the end of 6 months? Do we sort of rejoin the end of a list, or is there any decision around that?
Right. Great question. So right now we are just trying to get, as many people vaccinated as possible. So no, at this point, I wouldn't recommend that anyone needs to get a third dose of vaccine in 6 months. Right now we kind of have this race between vaccination and the variants. We want to vaccinate as many people as possible before the variants become more common in our communities. So I would say the first thing to do right now is to help all the elderly people in our communities get vaccinated. So elderly people in your own family who may not be as savvy with these vaccination clinics, which I know are difficult to get into in New York or can be difficult to get into in New York State, trying to help those kind of people that are in the groups that are currently being vaccinated. I think we need to first help those people get vaccinated. And the quicker we all reach that vaccinated number of 70% vaccinated in our communities, the quicker we will be able to kind of strip away some of these other slices of Swiss cheese and just rely on the one slice of the vaccine.
You mentioned the variants there. So we have the South African variant, the Brazilian variant. Is is that going to like, how does that play out with the currently approved vaccines? Like, are they, oh, you have a slide for it, but I'm just that concern that people have.
Yeah. So yeah, the variants are concerning. We are calling them VOCs, or variants of concern. Not very unique of a name, but these are mutations in the spike protein. And there are various variants. So, I should start by saying that we're not surprised that viruses mutate. If we allow viruses to replicate, they'll mutate. So that's just what they do. They like to change so that they can have more hosts to jump to. We are finding that the UK variant, the B.1.1.7, is looking like it's more transmissible, meaning more contagious than the predominant wild type strain that we find in the US right now. It may be that some of the variants have an increase in disease severity. They may cause you to have a more severe illness, particularly the South African variant, the B.1.351. And then also, unfortunately, we're seeing in some parts of the world, especially like in Brazil with the P.1 variant, and also in South Africa with the B.1.351 variant, that it may be that prior infection offers less protection, so that you can actually be reinfected with one of these variants. So all of these variants are certainly concerning. We haven't seen a large number of these variants in the US yet, but many epidemiologists are saying that we will see a transition between the wild type strain to these other variants later this month, and definitely in March, which is another reason why we want people vaccinated as quickly as possible. We do have some really positive news from both the Pfizer trial and the Moderna trial, saying that, again, both of these vaccines appear to be still effective against both the UK strain and the South African strain. And as I said before, maybe they're not at that super awesome level. Maybe they're at the sort of awesome level, but they still seem to be effective at producing neutralizing antibodies for people that encounter those variants. So this is another reason I would highly recommend anyone who can get the vaccine, get the vaccination as soon as you can before these variants are more around our communities.
And someone just said, back to side effects, if you were to get side effects, like how long, like you said 24 hours you felt rough, like how long do you expect people, is there an average amount of time people might feel a little under the weather?
Yeah, so we're saying usually 24 to 48 hours. I actually felt not myself for 72 hours. So I we would highly recommend that 24 hours after you get the vaccination, you make sure that you're able to rest, you're not overly exerting yourself. Again, you want to give your body the time out to develop that immune response. You don't want to be taxing your body as it's developing the antibodies, because we want it to develop as many antibodies as possible. So I would, ask for a day off if you're working the 24 hours after, and let them know that it's because of the vaccination. I think that, we have really only seen 24 to 48 hours, but if you can take an extra day to rest and relax, that would be recommended.
So I suppose all of us I'll put myself and getting vaccinated is this hope that we can return to some normality, in workplace and school life and family life and stuff. But being vaccinated, like I know myself, social distancing, wearing mask, they need to continue.
Yes. So it's not a great message. I know people are struggling with that message. They're saying, well, why should I get vaccinated in the first place if I have to still do all these things, which is a reasonable question.
Mm-hmm.
So the reason we want people to continue doing these non-pharmacologic interventions, it's the stuff, let me go back, it's the stuff that I talked about earlier, the slices of Swiss cheese, staying at home if you're sick or exposed, wearing a face covering, physically distancing, keeping your hands clean. The reason we want people to still do all those things is because we can't rely on the slice of Swiss cheese of the vaccination alone until we achieve this herd immunity. And herd immunity is when we have 70–75% of a given population who has immunity. And now you can get immunity via two mechanisms, right? You can either have had the infection itself, which gives you immunity, or you can get the vaccine, which also gives you immunity. So we are estimating in the US that we need around 230 million people vaccinated before we achieve herd immunity in the entire US. And I do think that there will be communities, such as maybe California and New York, where there is a very high uptake of vaccinations, but there will be other communities that may not want to get vaccinated and may not achieve that herd immunity. So while we are waiting for everyone to get vaccinated, while we are waiting and know that our children who are under 16 right now cannot get vaccinated, we are still recommending from a public health standpoint to do all of these measures that we've been asking people to do. But we don't think it'll be forever. We think it'll be until we get to that herd immunity. And then the other caveat too, Mark, is that if there are two people who are vaccinated, who are from different households, it is possible for those two people to interact normally without a mask, indoors. But if there is a slight chance that that person could have asymptomatic infection and then carry it back to their household with children, with other people that are not vaccinated, it just behooves you to think through all of the bubbles that we are in and who's vaccinated in those bubbles. But we do believe that two vaccinated people can interact with each other relatively normally.
Yeah, I think that's something like all of us are looking for lights at the end of the tunnel, and
Yes.
that ability to be able to, whether it's a loved one that who's vaccinated as well, that you can actually have dinner with, and it's nice to see her. But I think at all times it boils down to the level of risk that you're willing to take, or your family is willing to take, or people in your bubble are willing to take.
Yeah.
I was sort of following up with the being back. So we were in behavioral health workplace.
Mm-hmm.
And a lot of our colleagues and people, our frontline staff who have had the option to get vaccinated, does it mean the workplace, like if it's safer, it's a larger group, say there's a office and 70% of people have been vaccinated, could we all take our masks off inside at the office?
Yeah, it's an interesting question. I think there are a couple of things that I would caution. One is, how do you really know someone else is vaccinated?
Mhm.
Unless you see their vaccinated card, which I understand now can be, what is it called, counterfeit, or can be, yeah. So it's number one, how do you know who's vaccinated? Now, of course, in your own family, you'll know because someone will honestly tell you that they're vaccinated or not. So that's one thing to consider. At the organizational level, it is possible, if a bunch of people are vaccinated, it is possible that you can consider being more normal, right? Taking a face covering off, physical distancing. But again, remember, though, each of those people goes back to a household with people that may not be vaccinated. So, so it is something to consider, how transmission looks and what kind of risk you're willing to take. I think in the behavioral work aspect, though, one thing to really consider is if you have clients that are not vaccinated, or who don't want to be vaccinated, how do you continue interacting with them? We would recommend that you still wear a face covering, wear a face shield if you're getting within 6 feet of them. We would recommend all of those things that we have been recommending before, but you will feel more protected because you will be protected from death and hospitalization. So you will have an extra feeling of protection, even behind the face covering and even behind the face shield. And then the last thing I'll just mention about this is that, especially with clients, they look up to you as behavioral health, providers and their confidants. So take a minute to explain to them why they should get vaccinated, and tell them about your own experience with vaccination. That will help them. When I started talking about my vaccination experience, I had a lot of friends and colleagues say, wow, you're the first person I know that's been vaccinated. So for them, it was finally somebody that they actually knew and trusted telling them about their vaccination experience. So as leaders and role models, especially with your clients, I would highly advocate talking with them about your experience with vaccination, and hopefully your positive experience with vaccination, and trying to get them to get vaccinated too. Because again, the more of us that get vaccinated, the more all of us are protected.
It's, and it's actually was one of my last sort of questions was in relation to talking to people that we work, or clients that we're serving and stuff, and how to raise the questions. And somebody what you outlined here is has certainly given me the knowledge to be a little bit more informed in conversations that I have with folks. So thank you for that. And I probably will revisit that just towards the end. And if others have questions, to put them into the chat box. But two things. One was in relation to, oh, no, it's going to go took out of my head. I do have a question here that someone had asked, and and going through questions people put forward, it's like dating, and in realities of our day-to-day life, going back to dating, and does it become a question like to raise with people about vaccination and spending time with people? And it was just interesting because it was one that hadn't sort of crossed my mind. So.
Yeah, I think I just decided to take my slides off so I can see the chat too. So dating is really an interesting one. It is, I think there's been a lot of advocacy around dating via a screen. And I think that there are a lot of people that have done that. But, I think that we still need to, well, there are two things to weigh, right? Interactions with people that are so important for our humanity. And certainly if you're single and you're wanting a partner, this is the time where you're seeking that out because we're all so isolated. So trying to find a way of dating and interacting safely is something that I think is possible. We recommend wearing a mask indoors. You can still do that, although some people think that you can't see your face as well. You can interact with people indoors with a good mask, and 6 feet of distance isn't actually that far. You could potentially sit 6-7 feet away from somebody else. So I do think that there are ways of being thoughtful around dating and trying to still interact with one another, which I think is really extremely important. And then certainly if you're vaccinated and you can sort of kind of corroborate that with a new partner, that would be even more reason to feel comfortable. I mean, the verbiage right now is that two vaccinated people can be as close as two spoons in a drawer. So, I would think that if I was dating, that I would really want to make sure before I got super close to somebody else without a mask on, that they are also vaccinated.
Interesting. And so that was just sort of a side question that I had during the week. And one thing I was thinking about before, and I think it's relevant to our workforce. I certainly experienced some of this, and I think you mentioned you may have as well. But having some guilt about actually being offered the vaccine, and particularly perhaps before more vulnerable people in our community. And I've heard of people saying like, no, I'll wait to let someone else go first. And yet it doesn't seem to work that way. But I think there has been, talking to friends, guilt around taking the vaccine.
Yes. I think many of us, especially at the beginning, felt when your turn came up, if you were given the opportunity, did you feel like you needed to take it, especially if many of us are doing work that doesn't put us directly interacting with other people. So yeah, I think there is a lot of guilt around this. And what I would just say is something we used to say about antibiotics, and we still say about antibiotics, that taking an antibiotic is kind of it has societal ramifications. It has an individual therapeutic benefit, but it actually has a larger kind of societal impact. And I would say for vaccines, the more people that are vaccinated, the more people that are protected, the more our community is protected. So it is an individual decision, but it really does impact all of us and how quickly we can get out of the pandemic. So I wouldn't jump over anyone to get a vaccine. I don't think that is helpful, but I would recommend getting a vaccine as quickly as you're able to do it within the phases that are outlined in every jurisdiction. So, and I would say, take it, be proud of it, and feel that you're doing something not only for yourself, but you're doing something that helps protect the entire community and hopefully gets us out of the pandemic that much faster.
Yeah. And it's interesting because I talk about that, and you had mentioned the sort of the Photoshop, be proud, and you do get these little cards when you've completed. And it was me who told you, like, I had heard that people are Photoshopping them. I sort of struggled why, but some people wanted to, like, they've had the vaccine because they're nervous to get it. And we were talking before, there's so many myths out there and misinformation. And maybe at a future town hall, we'll sort of address some of those. Like one I had read about was something you had said about a nurse in Alabama who died after having the vaccine within 12 hours. And they untangled it in this news article about, like, no one could identify where it started. But all of a sudden it was someone's aunt or someone knew the person. But there's so much misinformation, and I think it's really important to have forums like this sort of to raise some of those.
Right.
There was a question in the chat here. If a person gets COVID and recovers, but is then immediately exposed to someone else who has COVID, is it still too soon where they would not have the built up antibodies, and can the person become reinfected? And then can they be a carrier and affect others they come into contact with?
Yeah. So yeah, we don't believe that somebody who has had the virus and recovers, we think that at least it takes 3 months, if not longer. I mean, there's some studies that show antibodies can last for 8 months after infection. So, we definitely believe that after you get infected with the virus and recover, it's really hard to believe that you're reinfected with that same wild type strain. And then in terms of being a carrier, no, we're not really seeing that either. We're not seeing people be carriers and then infect others. And then in terms of quarantine period, that's a really good question. Outside of the 3 months after you're infected, if you do come into contact with another case, so positive COVID-19 positive person, and you have had a real exposure to them, we probably would recommend still a quarantine period again. But that's after 3 months, the 3 months of being recovering from that from the initial infection. Reinfection, I know somebody else asked, reinfection is actually really uncommon. We really are not seeing that now. With the variants, we might see more people get reinfected. But up until now, we've had really just a few isolated cases of reinfection. We don't commonly see on reinfection at all.
Mhm. And I suppose one sort of last question I have is, you mentioned before, somewhere like New York, vaccinations uptake is high. And you don't see that perhaps in other states and stuff. And you mentioned the 70% for herd immunity, which I had heard would potentially be September if across the United States. Is it possible like New York could get there earlier and let our guards down a little bit? Like,
Yeah, it is. It is possible. I mean, in fact, I heard yesterday the Biden administration was told by Pfizer that that Pfizer was going to get 200 million doses out to the U.S. by May, not July, which is what the original promise was. So, there are other companies like I believe GSK that's also now producing the Pfizer vaccine. So as we get more vaccines out to people, as we start going through the phases more adeptly, it really depends on what uptake looks like. We have a lot of healthcare providers that have refused the vaccine. We have a lot of communities of color that are refusing the vaccine. So, we will see. We're hoping right now. I feel that we have a lot of people who want the vaccine. We have a big demand and low supply. But once we run through all of those groups who want the vaccine, and then we have a lot of vaccine available and maybe not a lot of people who want to take it, we'll see what percentage at that point we are at in terms of what percentage of the population has been vaccinated. You probably know that as of, I believe as of this morning, we have 10% of the population of the US population as a whole that's received at least one of the doses of the vaccine. So, we still have a long ways to go before we have vaccinated 70% of the population.
And before I get to one or two of my last questions, just for folks to know, we are doing a sort of a very brief survey, and that once this webinar closes, it will direct you right there. It's a sort of a knowledge and perspective survey. So it's basically just answer with your gut, the first thing that comes into your head, and it relates to sort of COVID and sort of the knowledge that we have and different perceptions that we have. And the idea behind it is that we can use that to sort of shape future offerings, and so that we're sure that we're tailoring this to areas that people have an interest in. And obviously we run our other SAMHSA trainings through our training institute. If you are not on our training calendar email list, reach out to myself or Emily, and we will make sure that you receive. They are all free for CBC member agencies. And so, I mean, I'm sort of close to sort of wrapping up. I wondered, though, we talked about 2 vaccines and Johnson & Johnson in the pipeline.
Mm-hmm.
There are others too. Should we expect in March, April, May that the market's going to be flooded with various options? And is there anything we should be looking out for?
Yeah. So the AstraZeneca Oxford study, the AstraZeneca Oxford vaccine, which is also a vector-based vaccine, we believe that vaccine will also be given EUA approval, most likely this month in February. So we will likely see at least 4 vaccines that are available to us in the US, 2 mRNA-based vaccines and 2 vector-based vaccines, one of which will be the J&J vaccine, which will only require 1 dose. The other thing about the 1-dose vaccine is we are likely going to see that vaccine get pushed out to rural populations, places where they do not have that extreme refrigeration capability, where they can just give 1 dose and you can do that one and be done. And the AstraZeneca Oxford vaccine, I think we will probably see that one go to all the different places that are currently getting the mRNA vaccine. It requires refrigeration, not the extreme refrigeration. That one we also will see come on the market as well. So like I said, I think that when you go to a vaccination center later this month, even next month, you will likely be given a vaccine and be told when your second dose will need to happen. But I don't think there will be a lot of picking and choosing as to which vaccine you are able to get. And there doesn't really seem to be any real difference between any of the vaccines right now in terms of which populations were studied with the phase 3 trials. So yeah, so we are hoping there will be at least 4 vaccines on the market later this month.
And so I suppose I'm going to sort of end around this, but back to the people that we serve, and not even just necessarily people we serve, but perhaps some of the seniors in our community. Something that I would just put out there, if we want to support those folks, some of it can be helping registering for vaccinations. It's not like, if you haven't tried it already, it's not the easiest process to navigate. And a lot of it is online, which a lot of members of our community may not have access to the computers in the way that we do, or even just repeatedly trying to get onto different locations. And, you know, I don't know what Dr. Trivedi, if you have more to say on that, but I think sometimes being able, I know my local community, we've helped some of our seniors to register.
Yes, I would highly recommend that. You know, a lot of our seniors who are educated, who want the vaccine, expect that their healthcare provider will call them and tell them when they are eligible. And that's just not the system we're in right now. We have to advocate ourselves to get these vaccines. And although you can get it through your healthcare provider, you know, I recommend people look at all different avenues, figure out, I know there are a couple of vaccination websites in New York State that you can go to try to get an appointment. It's important for us to help our maybe less savvy, computer savvy seniors get vaccinated. Because if you look at risk by age, by job, by various underlying conditions, the risk by far increases dramatically as you get older. So the risk of hospitalization and death is like, I think it's like 230 times that of an 18 to 29-year-old if you're over 85. So your risk of dying from this is so high compared to younger adults if you are over the age of 65. And so I would highly recommend, you know, we actually walked, my son and I walked down our street and talked to some of our elderly neighbors and asked them if they needed help getting vaccinated. I think that is a really valiant and useful thing to do right now to make sure that the people in our communities that are older, that have a really high chance of having a poor outcome to COVID, be protected with the vaccine. So I would really recommend that.
Thank you, and I agree 100%, but I'm not even sure who's on the call today, but I'm going to push for younger people to do it as well, because I think something that surprised me over the course of the first year sort of COVID was those people in their 20s and 30s who died. And I you know, when it first came out, there was all this focus on nursing homes and stuff, and I was surprised. And there was a teacher near us in his early 30s I was telling you about. And I think there is still so much unknown about how someone's body is going to react to the virus, that in itself hopefully will encourage people. And then lastly, on my side, like I was saying, when you come out of the vaccine, there isn't any instructions of what to do. Have the CDC released leaflets and brochures and stuff that can be shared with community members? I haven't seen them, but I'm just curious, like and some of our providers may already have them, but I'm wondering if you know of any sort of links and stuff that could be printed, shared with our community members.
Sure. Yeah, I think that there's some really good like FAQs around vaccines, addressing some of those myths you mentioned, Mark, around, I've heard things about, does it cause infertility? Is it injecting a chip into my body? Those kinds of things. So there are some FAQs. I've seen them both in the New England Journal of Medicine and the New York Times. So I can definitely, we can send those to folks if they're interested. And then the CDC is doing kind of a whole review of all of their recommendations right now. So we should be seeing some really great, thorough, recommendations and info sheets come out of the CDC around vaccinations. I think that there probably is some information on the CDC site that we can direct folks to. But just to address your last point about younger folks, for those of you that are thinking about, should I get vaccinated or not? which is definitely a valid point to consider individually. You know, as we've been talking about, taking the vaccine does potentially have some risks, but the risks, I think, are much lower than if you contract the virus itself. And I think I mentioned for older people how high the risk is of developing severe disease, dying, or being hospitalized. But this infection is also infecting younger people. So in this study that was done in a number of hospitals around the country, I believe 419 centers around the country, they looked at 3,222 18 to 34-year-olds who got COVID that were hospitalized. Now, those of us that are in the hospital know that when you see a young person like this that has to be hospitalized for COVID, they are quite sick because usually they don't have many underlying health conditions. And this occurred between April and June of last year. Of this group of 3,200 young adults, 21% of them required intensive care. So a fifth of them required some sort of intensive care in the ICU. So that number, I think, is quite staggering, that a fifth of them required that level of care, and 3% of them died. So this virus doesn't care who you are. It doesn't care what color of your skin you happen to have. It is extremely good at replicating and creating havoc on our bodies. And so that's why the vaccine and vaccination is so incredibly important. We want to especially protect our Black and Brown communities, given that we have so much health inequities in that Black and Brown population. But I also want to take a minute to just talk about the young adults and say the young adults absolutely are still affected by this virus and should also get vaccinated. And there's some recent data coming out that young adults are actually spreading and transmitting the virus very well to older adults. So you know, we may actually want to vaccinate the younger group of adults, because that way that we actually may decrease the spread of the virus in and of itself.
But, and so that begs the question a little bit, people under 18 or under 16 in the Moderna case, will there be a vaccine for our young folks?
Yeah, great question. So currently Moderna and Pfizer have enrolled 3,000 12 to 15-year-olds or 12 to 17-year-olds, depending on which vaccine. And we are in the process of watching those placebo recipients and the vaccinated recipients in those two studies. We won't have data for 6 months because they're younger, they're children. They have to be watched longer than the adults have to be. So if those studies are positive, we expect the 12 plus years, the 12-year-olds and over to be offered a vaccine maybe at the end of this year, if not the beginning of 2022. But for the younger, the 0 to 12 years of age, we don't have any, as far as I know, we don't have any studies occurring in that age group. So we won't have any vaccines available to those children.
Well, you know, I think with that, I'm going to just say thank you to everyone. Please, I'm going to ask you to do me a favor, and when you get connected to the survey, just to complete it, it would be really helpful. But I wanted to thank Dr. Trivedi for your input, and as always, it's a pleasure talking to you, but you're so knowledgeable, and I really appreciate it. On behalf of our network, just would like to extend my thanks to you.
Thanks so much. It was really fun to talk to you again, Mark. And yeah, I would just recommend everyone, after you get off the call, please fill out our survey so we can really target our future educational offerings to what you really want.
All right. Have a great afternoon, everyone, and thank you again so much. We will post the slides to you. So take care.
Bye.